Hello, today we're going to be discussing the ethical and legal issues of mandatory flu vaccinations for healthcare providers. But before we discuss flu vaccinations, let's first talk a little bit about ethics and law as they relate to healthcare. Ethics in healthcare is not a new concept. As far back as 2250 BC, medical codes of ethics can be found, continually evolving through the Hippocratic Oath in 400 BC, Percival's Medical Ethics written in 1803, the American Medical Association Principles in 1847, and the more current American Medical Association Principles of Medical Ethics. Ethics can be viewed through a lens of medical ethics, which looks at an individual's well-being, or public health ethics, which is more of a population-based. And either way, there are ethical frameworks and principles that should be considered when making any healthcare policies. There are 7 general principles of healthcare ethics: autonomy, beneficence, non-maleficence, confidentiality, justice, role fidelity, and veracity. And we'll discuss these in detail a little further as they pertain to mandated flu vaccinations. So as technology in healthcare changes, so must our code of ethics to include previously unthought of scenarios. And this makes for a seemingly endless array of ethical issues facing the field of public health and healthcare, and mandatory influenza vaccinations among healthcare workers is no exception, as it has become a pretty divisive topic. So we talked a little bit about ethics in healthcare. Let's talk about the importance of understanding the law and legal profession as a healthcare provider. An understanding of legal and ethical implications is extremely important for healthcare professionals. Judson and Harrison point out that studying law and ethics will not only help healthcare professionals function at the highest possible professional level, providing competent, compassionate healthcare to patients, but also hopefully aids the healthcare practitioner from getting into any legal issues that may compromise their license. Knowledge of law and ethics also helps the practitioner to see the patient's point of view and understand their rights and expectations. Better understand the ever-changing field of healthcare and how ethical issues may change and evolve with new technology, costs, and delivery methods. And finally, the challenges of ethical and legal issues persistent in society today. Now that we've talked in general about law and ethics, let's apply it specifically to mandatory flu vaccinations for healthcare workers. But first, a little background on influenza. The annual seasonal influenza causes symptoms of fever, muscle aches, chills, fatigue, headache, cough, and congestion. And it can cause respiratory issues that range from mild to severe. It should not be confused with the stomach flu. It is something totally different. And the flu is not always harmless, and not everyone recovers without serious consequences. It can lead to hospitalizations and even death, especially in the vulnerable populations, children, elderly, pregnant women, or those with compromised immune systems due to other conditions. And on average, there's almost 24,000 deaths per year and 200,000 hospitalizations from the flu. In fact, it is the most frequent cause of death from a vaccine-preventable disease in the United States. It spreads most often through droplets when people cough, sneeze, or talk, and those droplets can fly for about 6 feet from the person. So sometimes the flu is transmitted by touching a surface, someone that if the flu had touched, and then touching your mouth or nose, but that's less common. It's more often spread by droplet. And it can be contagious before symptoms arise and for up to 7 days after, which means you could be transmitting it before you even know you're sick. The annual flu vaccine is recommended for everyone over the age of 6 months unless medically contraindicated. It contains several strains the researchers believe will be the most common during that year's flu season. And it's been recommended for healthcare workers since 1984. However, the rates are still very low. The HHS calls the vaccination of healthcare workers the cornerstone of flu prevention. So the question arises, should flu vaccinations be mandatory for healthcare providers, and do mandated policies or laws have legal justification? We know that the government has the responsibility and the power to protect the public's health, and sometimes this means the liberties of some must be restricted for the common good. 19 states have regulations regarding mandatory flu shots, ranging between one of 4 different requirements. The first one is assessment of requirements, which means the facility must assess whether a healthcare provider is vaccinated or not. The second is offering vaccinations, which the facility must offer all healthcare workers a flu shot. Number 3 is ensuring vaccination requirement. Facility must be provided proof of immunity or vaccination. And number 4 is wearing surgical masks. If the healthcare worker does not receive vaccination, they must wear a mask during the influenza season. In 2009, Virginia Mason Hospital in Seattle was the first facility to mandate flu vaccinations. And currently there are over 300 facilities that do so. Dr. Jorge Prada of Loyola University Medical Center in Chicago, which has a mandatory vaccination policy, says that our employees and associates now understand that this is the way we do business. Just as construction workers wear steel-toed boots and hard hats on job sites, healthcare workers should get a flu shot to work in a hospital. There are some exemptions to the mandate, which include medical, religious, or philosophical. If an employee is requesting an exemption, there's usually a form that must be signed by the individual, and sometimes also by their physician or a member of their clergy declaring there is in fact a valid excuse for requesting an exemption. As I mentioned earlier, this is a very divisive issue, and it has compelling arguments both supporting and opposing a mandate. Beneficence, non-maleficence, and autonomy are the most common ethical principles cited in arguments surrounding the issue. The American Academy of Pediatrics strongly supports the mandatory policy as they believe it is essential to protecting the patients. And they stress that healthcare providers should act in the best interest of their patients' health. Not only do they believe it's the right thing to do, but also the most economical, as influenza-associated costs in the United States reach almost $90 billion a year, when you include medical costs, mortality, and missed work. The AAP believes there's 3 criteria that should be met when you're implementing a mandatory health policy. The first is that there must be clear medical value from the intervention to the individual. Second is the public health benefit must be clear to justify the infringement on personal liberties. And third, the mandate must be considered the last and only option. So other arguments in support are that voluntary programs are just not working, and mandatory vaccinations are supported by several agencies, including the CDC, the American Hospital Association, American Academy of Family Physicians, and the Association for Professionals in Infection Control and Epidemiology. Voluntary vaccination programs have failed over and over to make substantial gains, and Healthy People 2020 has set a goal of 90% vaccination rates for healthcare providers, but a lot of facilities are not on track to reach that goal. Some ask what kind of example is set when healthcare workers tell patients to get vaccinated, but they themselves do not. It's hard to convince a patient that it's important for them and it's safe for them to do it if you don't believe it yourself. Beneficence means the healthcare workers should do what is in the best interest of the patient. If protecting the patients from the flu and ensuring there are enough healthy staff to take care of patients, especially in an outbreak, is doing what is best for the patient, then mandatory vaccinations should be supported. The principle of non-maleficence can also be used in support. If healthcare workers should do no harm to their patients, then preventing the transmission of the flu is essential to not harming patients, and therefore mandatory vaccines make sense. It could also be argued that healthcare providers have a professional duty to promote patient safety, making this a standard of care issue. Ottenberg et al. Point out that rumors and fears must not be a barrier to promoting patient safety and public health. There's a lot of myths out there that keep people from complying. One is that the vaccine is not safe, and the vaccine is very safe, and serious adverse events such as Guillain-Barré syndrome are as low as 1 in 1 million. And the vaccine cannot give you the flu, and approximately 1% of people vaccinated, flu-like symptoms do develop. However, these are side effects of the vaccine and not the actual flu. Many say they got the vaccination, but they still got the flu. And there can be a couple of reasons for that. First, it takes about 2 weeks for the body to build the immunity and for your immune system to work and make the vaccine work properly. So some people could be exposed to the flu within those first few weeks after getting the shot and acquire the flu. And second, it is not 100% effective. However, any immunity is better than none, and it has been proven that even if a vaccinated person gets the flu, the symptoms and complications tend to be less. Researchers in the United States watch the flu season in Australia, because their flu season is before ours, to see what are the most common strains, and then our vaccines are made accordingly. However, strains can mutate before our flu season starts, making our vaccine less effective. And also because international travel is so easy these days, some novel strains are brought to the United States that researchers didn't anticipate. So while it's not 100%, it's still your best bet for preventing the flu. On the other side of the spectrum are the arguments in opposition. Healthcare workers, just as all individuals, have the right to autonomy, to make their own decisions, especially in regards to their health. Mandatory vaccinations set a precedent which signify that people may no longer be able to choose what medical treatment they receive. Transmission of the flu tends to happen much more often in the community than in a healthcare facility, and if the general public does not have high vaccination rates, then the flu is still going to be spread whether or not healthcare workers are vaccinated. The Jacobson v. Massachusetts case is cited often as the basis for mandating vaccinations, although Miller and Ross say that comparing seasonal influenza to smallpox is like comparing apples to oranges, as the influenza has nowhere near the ramifications of smallpox. The flu shot has side effects, many argue, again, including an increased risk of Guillain-Barré syndrome. It's unnecessary, some people believe, because most people get the flu, recover just fine, and with no extreme adverse effects. And there are alternatives available, including hand washing, wearing masks, and isolation of patients in hospitals that have the flu. So what is my personal opinion on the matter? I'm in support of mandatory influenza vaccinations for healthcare providers. I think the benefit to our patients outweighs the risk to us. It's our job to provide quality, safe care, and this cannot be done if we're spreading nosocomial infections. I think most people do not understand the severity of the flu, and sadly, including many healthcare providers. Education is needed for them, just like we provide it to the general public. They're not immune to believing the myths they hear, like vaccinations cause autism, or it's going to give you the flu, or it's not effective. I think in the future we'll see many more facilities mandating the vaccine. And while there's a lot of lawsuits going on about the issue, I do think there is a legal basis for requiring this as a condition of employment. As talked about earlier in the quote about the construction workers, if I'm a construction worker, I can't just decline to wear my hard hat where it's required. It's a condition of my employment with the company that I follow that company's rules. So if mandatory flu shots are the company rule, then I think the company has legal basis for forcing employees to comply. At my hospital, we don't mandate it, but if you decline, you must wear a mask in all patient areas from November to April, and you have to sign a declination form and answer questions as to why you're declining it. It's mandatory that we get the vaccine or fill out the declination form. And while I do think the vaccine should be mandatory, there are exemptions in the case of religious objections and obviously if medically contraindicated. We should be setting an example for our patients. How can we ask them to receive their vaccine if we aren't willing to take it ourselves? As a Christian, I believe that we should stand up for the vulnerable and defend the rights of the poor and needy. And we're called to protect those that cannot protect themselves, which in my opinion would extend to patients under our care. Our patients are counting on us to provide care to them and not make them sicker, and many of them are in the worst chapters of their lives, so we owe it to them as healthcare providers to protect them in every way that we can. Thank you.